Comprehensive assessment of medication. Domain in CHC assessment. Is the individual able to take their medication independently, or do they require assistance from carers for administration? If assistance is required, do they need prompting, supervision, or full administration of their medication? Are they compliant with their prescribed medication, or do they exhibit refusal, forgetfulness, or reluctance to take it? If non-compliant, how frequently does non-compliance occur, and what steps are taken to ensure medication adherence? Is their medication routine straightforward, or does it require careful monitoring and adjustments based on their clinical condition? Are they prescribed PRN as needed medication, and if so, for what conditions? How often is it required, and how effective is it? Does their medication regimen include controlled drugs that require additional monitoring, storage, or specific administration? Protocols? Have they experienced any adverse side effects from their medication? And if so, what impact has this had on their health and care needs? Have there been recent changes to their medication regimen? And if so, what was the reason for these changes? And what has been the effect? Is medication administered via an alternative route such as PEG, subcutaneous injection, or transdermal patches instead of orally? If medication is given via PEG, does this require specialist training or professional administration, and how frequently is it required? Is there a need for covert medication due to lack of capacity or refusal to take essential medication? And has this been formally assessed and authorized? Does the individual require liquid medication, crushed tablets, or other modifications due to swallowing difficulties or other medical needs? Are any medications time-sensitive, requiring strict administration schedules, such as insulin for diabetes, Parkinson's medication, or anticoagulants? Does the individual have a condition that significantly impacts their medication management, such as diabetes, epilepsy, heart disease, or chronic pain? How frequently are blood sugar levels monitored if they have diabetes, and how stable are their readings over time? Do they require insulin injections? And if so, who is responsible for administering these? And how is their glucose control managed? Do they experience ongoing pain? And if so, what is the cause, severity, and impact on their daily life and well-being? What type of pain relief is prescribed? How often is it required? And does it adequately manage their pain symptoms? Is their pain chronic, related to a long-term condition, or acute due to injury or recent medical events? Are there any known triggers that worsen pain? And does their current medication effectively control or alleviate it? Is pain associated with end-of-life care, requiring the use of a syringe driver, or PRN subcutaneous medication for comfort? Has the individual undergone any specialist assessments regarding pain management, medication effectiveness, or necessary adjustments? Are regular blood tests required to monitor therapeutic drug levels for medications such as warfarin, lithium, or other high-risk treatments? Are there any potential risks associated with their medication regimen, such as overdose, missed doses, drug interactions, or adverse reactions? Have there been any recent hospital admissions or medical interventions due to medication-related issues, such as side effects or improper administration? Does the individual require additional monitoring from a healthcare professional, such as a pharmacist, specialist nurse, or consultant, for medication management? Is there evidence of poor medication efficacy, requiring frequent changes in dosage, type, or administration method? Has a full medication review been conducted recently to assess the necessity, effectiveness, and safety of their current prescription? Are there any concerns regarding the individual's ability to communicate pain, discomfort, or side effects related to their medication? Does the individual require support with medication storage, organization, or reminders to take it as prescribed? Has the individual ever experienced difficulty swallowing medication, requiring an alternative form or method of administration? Is the individual prescribed multiple medications that require complex scheduling, requiring assistance to prevent missed or duplicate doses? If taking PRN medication, how often is it used, and is it effective in managing the symptoms for which it is prescribed? If prescribed controlled drugs, are they stored securely, And is their administration closely monitored and documented? Does the individual have a history of medication misuse, requiring additional supervision or safeguards to ensure appropriate use? Has the individual expressed concerns, fears, or reluctance regarding their medication, and how is this managed in their care plan? Are there any cultural, religious, or personal preferences that affect medication administration, requiring alternative solutions or considerations? Are there any additional risk factors that could impact their ability to safely manage medication, such as memory issues, cognitive impairment, or physical limitations? Has a care plan been put in place to manage medication administration, adjustments, and any potential complications that may arise? Please share your thoughts in the comment section below.